Dr. David Manset studied artificial intelligence, and he is the CEO of Nubila France. And the work he has been carried out for the last 10 years focused especially on health and biomedical research. And he received several awards with his team for his work. And today he's speaking about big data health surveillance can be used for epidemiology and also for medical practice evaluation. Thank you.
Thank you. Thank you, Beatrice. Ladies and gentlemen, good morning. It is a pleasure and an honor for me to be here today to talk about the work we've done in health surveillance. As you've heard recently in the news, the world is facing a significant crisis with the Ebola virus disease. With more than 5,800 cases since March this year and 2,800 deaths, we are realizing how important health surveillance becomes. Not only this, but this morning you also heard that we've asked for 1 billion to support the development of such systems. So we are facing this problem. And Ebola is not the only disease. There are a number of pandemic diseases ahead of us for which we need such systems. So health surveillance is an absolute necessity in a globalized world. And actually, I would say not even only for pandemic diseases, but for all types of diseases. We indeed need to understand better about diseases epidemiology, about medical practices associated with this, to better inform policies, but also to better make decisions. So what the experts say about pandemic diseases is that there are many centers of transmissions, there are many teams of clinical specialists involved in addressing these problems. We need to trace contact, but the information is fragmented, and there is overall a lack of access to basic information. Additionally to this, there is a problem of heterogeneity in the data that is concerned. Data is locked in different silos and therefore fragmented from across the medical specialties involved. So understanding that data requires first integrating it into one single and global system. And understanding the data is a science in itself that may become computationally demanding. Last but not least, the concerned data is potentially sensitive. We are talking about patient, medical and sensitive data. So this raises data protection and access rights as well as patient safety issues. So, ideally speaking, to develop health surveillance systems, we need to set up information and communication technologies that allow collecting, filtering, controlling information from various sources in order to integrate and process these towards the definition of risks, towards the detection of new trends, prioritizing and developing efficient plans to inform and recommend policies. Some of these requirements have been addressed already by CERN in developing its Large Hadron Collider. CERN is actually a fantastic place where people develop ideas and turn them into technologies, from the web to the grid that you heard about this morning from the different talks from Professor Frizzoni and Richard McClatchy. And out of these technologies, there are very interesting ones, and one in particular caught up our attention, the ARDA Metadata Catalog Project, AMGA. AMGA is a particular technology that enables putting fragments of information coming from different places into one single data. So here what you see is a number of fragments of information coming from different sites that are put together in a hierarchy in a linked data representation. So AMGA makes it possible to distribute information and to federate information into one single system, thereby enabling its understanding from across different silos. AMGA also provides interoperability with standard databases, making it simpler to connect to existing silos. And last but not least, AMGA is coupled with the so-called grid technology that we heard about this morning, and therefore makes it possible to pair the data with computational power. So AMGA has been used in the past in several fields, from high-energy physics to climate modeling, digital libraries, and lately to medical data management. But what did we do with this technology? Back in 2011, we took on a new project called GINSENG, which stands for the Global Initiative for Sentinel e-Health Network Grid. This is a French-funded project from the French National Research Agency, ANR, that is being coordinated by CNRS and ALPC, and that witnesses the collaboration between a number of partners, including academics with the University Blaise Pascal and University of Auvergne, and the Hospital of Clermont-Ferrand, and a number of professional healthcare companies and associations specialized in the medical fields we are addressing. So the project has been funded by the French government to develop a health surveillance system addressing the problems of understanding the epidemiology of breast cancer, colon cancer, following pregnancy, and also following trisomy 21. So GINSENG has three main objectives. The first is to develop lightweight electronic infrastructure for e-health and epidemiology as a private and dedicated facility focusing on these medical specialties. And it is aiming at developing a network of healthcare professionals to collect, aggregate, and analyze medical data being shared between the different partners of the project, from the screening associations to the anatomopathologists to the health surveillance organizations and concerned hospitals. In GINSENG, what we did is to develop a system as an open architecture that makes it possible for different types of partners, from the screening structures in charge of sending invitations to citizens for screening cancer, to the pathology labs in charge of actually diagnosing, or even to sanitary organizations such as the INVS in France. To do so, we've been using the AMGA technology, and what we did is to develop a system that makes it possible to partially replicate the information of these centers and make it available in a new virtual network where this information can be exploited computationally to understand better the epidemiology of the concerned pathologies. So we've developed this network and a standard web portal on top of it, allowing professionals with their professional health cards. This is the French system that provides professionals with cards with their identities embedded on them, so they can connect to that facility, access the data, and analyze the data. So we've built this network as a highly secure infrastructure with strong authentication within a virtual private network, and with all communications being encrypted. And this was made possible thanks to the AMGA technology developed at CERN. And this particular architecture made it possible for us to obtain the approval from the French National Informatics and Liberty Commission to process and analyze medical sensitive data. So the GINSENG electronic infrastructure is there to help improve cancer screening process, support better epidemiological studies, for instance, comparing incidences of disease and compared with the actual geographical location of patients, but also enable practices benchmarking from across the medical centers involved. So what we've been working so far is actually what we call today big data for healthcare. So we are developing electronic health solutions to support big data systems development, enabling the integration of massive amounts of heterogeneous data. And I will conclude my talk by just talking about upcoming trends in the area. There is one that you certainly have heard about, which is called mobile health, that is coming up, that is actually being pushed very strongly by Apple with the HealthKit technology and Samsung with the S-Health technology. This is a new paradigm where the data is coming top down. So the data is being collected from the mobile devices and being exploited throughout the application, so it doesn't require any ethical nor interconnection with the hospital, and it can process your medical information. The second that's immediately following mobile health is Internet of Things. Connecting devices are coming up. You've certainly seen wristbands and all the likes that are monitoring diverse parameters and analyzing your health. So all this is coming together and will, I believe, become pushed to a major paradigm shift. It will help unlocking the data, which is the problem we are facing today. Today we have lots of medical data locked into our hospitals and medical centers, and this is what we are trying to solve with global information systems, exoskeleton systems that are making it possible to connect the silos. But this revolution at the top will also help going towards unlocking data. But this will raise new concerns in terms of data protection, because you will be monitored on a daily basis, and potentially one could make use of this data for other purposes than actually saving lives and improving health. Last but not least, I believe that new patient-centered policies will take birth from this. Nowadays, data is, as I said, stored in silos and is mainly business-oriented. What we want in the future is patient-centered policies where the patient himself can take control over his own data throughout these systems, and therefore make decisions as to whether share or not this data, copy or not this data, delete or not this data. So what we are working nowadays with my company, Ginubila, is the development of global information systems for handling all these types of data. Thank you very much for your attention.
Thank you. Any question? Yes.
I have a question. You have mentioned Ebola and other diseases. All these diseases is a threat to humanity. In other words, you are in a war against these diseases. Have you ever addressed yourself to military competences to discuss how they fight an enemy in real time?
As far as I am concerned and my company is concerned, we haven't addressed this problem. We are partnering with different institutions that are working on satellite-based systems to solve the problem of local on-site connectivity, and that is one of the main developments nowadays. I heard also about recently some initiatives in Africa that are working on GSM-based protocol to monitor and share basic data, patient data, thus allowing on a lower bandwidth network to have this data exchange. But as far as we are concerned, we haven't addressed this problem as of yet.
Other question? Yes.
Yes, thank you. I would like to know if you have any collaboration with other countries. The way I understood it is basically in France.
Yes, the initiative I've been presenting here is French-based, and it's actually a prototype, a pilot system we've deployed in the Auvergne region. So that's a regional system we are testing right now.
Other question?
How much?
Yeah. Just over there. Yes, please.
Yes, you said that in this portal, patients could decide which information should be kept and which could be deleted. But then you have a problem with data accuracy, because how will you process this information if you can tell basically the patients they can decide what they want to delete and what they want to keep?
Yeah, well, you may have heard about it, but the European Commission has been working on a new data protection regulation, actually a rule, that will be enforced in 2016, that is very soon. And that law will give every citizen the right to be forgotten in all information systems. So no information systems nowadays are ready for that, absolutely none. But this is a reality that all IT providers will have to deal with.
Another question, David, how can one think about the contribution or the awareness of international and national public bodies of the importance of having such type of development going on and getting more interdisciplinarity into it?
So is your question how to extend this to a larger number of stakeholders in the area of health surveillance, or more generally speaking?
In the area of health range.
Well, these topics are being discussed at the United Nations. I'm personally intervening as a contributing member to the Electronic Health and Standardizations Fora at WHO. And these are core topics being discussed between different types of stakeholders, from academics to healthcare professionals, standardization bodies, but also governments. So I think that the debate is well ongoing. The question is how long it will take to develop these solutions and make them available.
Thank you.
Thank you.
Thank you very much.